According to migraineresearchfoundation.org, more than 4 million adults experience chronic daily migraine, with at least 15 migraine days per month. Furthermore, migraine is the 7th most prevalent illness in the world, affecting 1 billion globally. Here with more on migraine prevention and treatment is Dr. Katherine Standley, neurologist with Florida Medical Clinic. Welcome to Insights South Florida.
Good morning. Thank you for having me.
Absolutely. This is a topic, Dr. Standley, that is very personal to me because I have suffered with migraine for so long. But for our viewing audience who's not aware of what migraine is, can you please shed some light on the illness?
Yeah, absolutely. So you talked a bit about chronic migraine. So there's actually episodic migraine too. Those are people who have less than 15 headaches out of the month. They usually have similar symptoms of patients who have chronic migraine, just less frequent. And so that's actually seen in almost 40 million people in the United States. And migraine is not just a headache. Migraine is disabling for a lot of patients. And so they can have throbbing, pounding headaches, and they typically have either light sensitivity, sound sensitivity, or nausea associated with it. These headaches are not short acting. They last for 4 to 72 hours, so they last a long time. And one of the hallmarks of them is that they're worse with movement. And so usually these patients have to go lay down and rest, and they're not able to carry on with their activities of daily living.
That is 100% accurate. Mentioning laying down, how debilitating a migraine headache is. It takes you out for a period of time. What causes these? What are the triggers? We know that stress is one of them, but what else triggers a migraine?
Yeah, so it's interesting. So there's been a lot of research into this recently. So we do know that people who get migraine are probably genetically predisposed, but then there are environmental triggers, and those triggers for patients are different. And so, right now with spring coming and the weather changing, weather can definitely be a trigger, and barometric pressure changes. Food can be trigger, stress can be trigger. Obviously with the COVID going around, that's been increasing a lot of stress. Also, patients have been having post-COVID headaches as well. And so we've seen a lot of migraine recently.
Lifestyle. You mentioned that there are external triggers like the sun, weather, stress, but lifestyle changes though to combat that. How can we make changes to our lifestyle to help migraine attacks?
Yeah, so one of the biggest things that I recommend that patients do first is figure out what their triggers are, because the trigger's not the same for every patient. And so usually what we do is we have them keep some type of headache diary, and in that headache diary, we're having them track their migraines. And being able to track their migraines and see what that trigger is, then we could work for trigger avoidance. But first, we actually have to identify what those triggers are. So really, the first thing is getting a really good understanding of migraine and what triggers your migraine. And the way that we usually do that is by keeping a headache diary.
Dr. Standley, people still have a misconception about what causes migraines. It's very complex, yes?
Absolutely. And getting into the little science background about migraine, we've learned a lot about something called the trigeminal vascular system. There's actually a new class of medications out that work on a neuropeptide called CGRP. And we've learned that the trigeminal nerve, and specifically one of the trigeminal nuclei, that when we look at this in the postsynaptic space, that there's the release of CGRP. And CGRP is a potent vasodilator in the body. When it binds to the CGRP receptor, you get vasodilation, which contributes to that throbbing, pounding headache. So we've actually studied medications that block the CGRP binding to the CGRP receptor. One of those medications, one of the latest medications that was released, is actually for the rescue from migraine. It's a medication called Nurtec ODT. It's an oral disintegrating tablet that patients can take at any time without water. It just dissolves in their mouth. And a lot of patients have a significant reduction in pain. About 60% of patients are having some type of pain relief around the 2-hour time point. The medication is very well tolerated. The side effects that are listed are 2% of patients who do have nausea. And it's been very, very helpful in the treatment of migraine. And I've had lots of patients in my practice who have tried the medication, have had a very good response. Obviously, patients respond differently to different medications, but I have had a lot of patients have a very positive response to Nurtec.
So Dr. Standley, do you frequently see migraine in your clinic?
Absolutely. In my adult neurology clinic, migraine is one of the most common diagnoses that we make. and Nurtec ODT is approved for adult patients only.
That's wonderful. Great information. Thank you for sharing that with us this morning on Inside South Florida. Dr. Katherine Standley, neurologist with Florida Medical Clinic. Always glad to have you on the show. Be well.